Hi, welcome friends. Is Lyme real? Is it just imaginary? Stay tuned and let's learn more about this topic. My name is Andrika Kokliat. You can find me on Facebook under Post-Traumatic Growth or My Post-Traumatic Growth or Supernatural Boundaries. You can also contact me at 503-974-4848, and that takes text as well. I also host events at the library. I stream networking, health-related networking events available to practitioners or highly motivated, health-oriented people. And you can contact the library reference desk, and they can tell you each month when the next functional forum is happening. So it's called the Functional Forum, and you can get more information from the library reference desk under my name, Andrika Kokliat. That's A-N-D-R-E, J as in Jack, K-A, last name C-O-K-L-Y-A-T. So let's talk about the topic at hand. We're going to be doing a 20-minute, 30-minute video here. So I just wanted to talk about Lyme. And so it's called Lyme disease. It's not like limes as in a bunch of fruit. Lyme, it was named after a place in Connecticut called Lyme, Connecticut. And so, the standard thought about Lyme is that it's only on the East Coast, and latest research has indicated, like the National Institute of Health, NIH, has found that if an uninfected tick stings a person who has an infection, whether it's Borrelia, which is what we understand to be Lyme, which that's what we are calling Lyme. It's the Borrelia infection, but there's hundreds, if not thousands, of potential infections. Anyways, when a tick, such as any one of these types of ticks, stings a person, and if they sting, if these are ticks without any infections, if they sting a person who has an infection, then this tick then becomes infected, and then the next dog or person or whatever that it injects will then become infected. So I have met a lot of people who are like, well, there's no ticks in Montana. Now, I don't understand how people haven't heard of people traveling to Montana, or, I mean, like, it's a very interesting, it's as if they think ticks respect borders. Like, ticks are going to be like, oh, we're not supposed to be here. Lyme isn't supposed to be in Montana, so we're not going to be, no. Like Lyme disease and all its co-infections do not respect borders. So we need to get clear about that Lyme is found all over the world. And not only is Lyme found all over the world, the rates were conservatively estimated as, pardon me here, they were conservatively estimated at by the CDC as 30,000 a year, and we find that they've revised their statistics and now consider Lyme to be something that's happening about 300 to 300,000 people a year. So there's 300,000 reported cases of Lyme a year now. So as you can see, these like Lyme is on a steady increase. So It's the people who have Lyme are often misdiagnosed. So, and what's unfortunate about Lyme is that it is something that, like I said before, an uninfected tick can uh, sting one person and then sting a dog or another person. So it can be transmitted from a parent to a child, from a dog to a child, from a child to a dog. Um, so so people might not be aware that Lyme can exist in Montana. Uh, and, you know, there are people who travel from the East Coast to Montana, and, you know, people from Montana travel to the East Coast. And so Lyme is not going to avoid a Montanan's, you know, fabric, clothing. It can happen. Uh, So, what are signs and symptoms of Lyme? And this is just the slightest description. So, there can be headaches, stiffness, um, the the uh, the Lyme lesion, erythema migrans rash only occurs. Why? And when I got my first Lyme rash, or the only one that I've noticed, I was told it's from the antibodies. So you only get that bullseye rash when you already have the antibody. So it means that I had had a Lyme exposure before. So when you get should you get a Lyme rash, it means that this is the first time or the second time or maybe the second, maybe even more. But you already have the Borrelia inside of you. So you know, people say, oh, they never noticed the rash. It's because it's their first exposure to the Borrelia Lyme bug. So Lyme, for some reason, they call Lyme, you know, based on Lyme, Connecticut, and then the scientific name is Borrelia, and so I guess it's a species, and then there's different types of this Borrelia species. So arthritis, joint pain is a common symptom of Lyme. And let us talk a little bit about symptoms, like how Lyme is diagnosed is like, unfortunately, it seems like doctors just want to do a test. You are your test. But are you your driver's license? Are you your GPA from college? You're a whole conglomeration of life experiences, subjective and objective. So that a test is an objective thing. However, according to the standard of care in the United States by the CDC, which this is from, it's a clinical diagnosis. And as I have been able to deduce, clinical diagnosis means that the doctor is making deductions based on your symptoms along with the testing. So doctors failing the patient if they are just looking at the testing and throwing all of the client's subjective symptoms out the window. That's improper practice. So if somebody is having headaches, stiffness, rashes, uh, severe joint pain, swelling, and what I noticed for me is lower limb edema, like major swelling at the ankles, at the calves. There's Bell's palsy, like one side of the face loses expression. It looks sort of like a stroke. Then there's pain that it's called migrating pain. So it can migrate from one shoulder to the elbow, to the knee, to the other shoulder. Heart palpitations, dizziness, shortness of breath. And want to go into the shortness of breath. There's also one of the co-infections. So Lyme is known as Lyme and co-infections because when somebody is stung by a tick, and it's not a bite, it's a sting, uh, the tick is usually filled with other co-infections, unfortunately. So more often than not, people are struggling with reactions to the Borrelia, but then you can have also not only the Borrelia infection, but you can have a Babesia, Brucella, Ehrlichia, Rickettsia. There's a whole variety of other infections. And so Babesia, the Babesia bug, can cause what's called air hunger, like a room feels super stuffy. So then there's inflammation of the brain, so that's encephalitis, and spinal cord, nerve pain. And then again, another one I believe with Babesia is um, pain at the heels, at the heels of your feet, and then problems with short-term memory. So Lyme is hard on your cognition, um, and uh, chronic Lyme can turn into this neurological problem. So a lot of doctors refuse to believe that there's such thing as Lyme. They refuse to believe that there's such thing as a persistent infection with Lyme disease. And it's very interesting because we know that there's other persistent infections in the world. And Lyme is a time-consuming project for a practitioner, and it's not a sexy like cancer diagnosis where the doctor's going to make the hospital $500,000, or it's not a sexy autism diagnosis where the doctor's going to make the hospital and the practice $3 million. Lyme disease is this wading through, trying to figure out like 100 different possible diseases. And I'm told, we have to have sympathy for doctors. They've got 15 minutes to spend with the patient, and they spend 3 hours on paperwork for each patient that they have. And I think that if a doctor is unwilling or unable to do the job, that's fine. Just tell me rather than gaslight patients that they're not really experiencing anything real, or that they need to go see a psychiatrist. I think if a doctor would say, I can't help you because our system is not equipped, just try to help yourself, rather than discouraging people from seeking a diagnosis. Many times I've asked doctors for testing, and I've been discouraged. They're saying there's nothing you can do. And the thing is, if you have an infection, if you have a flu or a cold or sepsis or E. coli, there's things to do about that, and Lyme is a real disease. It's a real infection with white blood cells and cytokines and inflammation. So there are things that people can do, and I think it's a crime when a doctor discourages a patient from educating themselves and actually remedying a debilitating, like Lyme is it's a horrible disease, and it's not a pretty disease. It's not a friendly disease. It's a destructive disease, and I'm shocked how doctors have been so negligent about just permitting me to track what's going on so that I can make some progress. So and maybe there's like, maybe I need to find greater compassion and sympathy. You know, these doctors somehow have a much more tragic, horrible quality of life, that maybe I need to um, grant them uh, a free pass, but um, it doesn't seem to be the case. So Lyme is a tricky diagnosis, I will grant that, but um, there are people who are figuring this out. So, you know, if a doctor is incapable or unwilling, what does that mean? When somebody is in this position of authority for health, for wellness, and they're unwilling or incapable, or even the very system is unwilling and incapable. What is that? You know, and like, what do we do with something like that? That's the question. So Lyme, um, people with Lyme have varying symptoms. So there'll be an ache in one shoulder, an ache in the hip, etc. You know, in the knee, and then Lyme, it's it's a it's like a great imitator. So a lot of people who have rheumatoid arthritis or lupus, Lou Gehrig's disease, um, and other multiple sclerosis, like they'll be diagnosed with that, and instead it's Lyme. So the blood testing is tricky because Lyme is not the persistent infection does not stay in the bloodstream. It prefers to sequester itself away from our autoimmune system, and so it will hide in the cartilage, and it also creates something called biofilm, so it kind of camouflages itself within the body. So further diagnostic methods are pretty heroic. One of which is a very painful spinal tap. Other is PCR, which is, I think it's like looking for the proteins. Then there's the ELISA test, which is that's the first recommended test by the CDC. Then there's clinical diagnosis, which I described to you, where the doctor takes into account the symptoms and the history and the valid, legitimate exposure that a patient might have had uh, to a tick. And then there's what's called the Western blot, which has what's called a band. So I have an example of what the bands look like. And for some reason, it appears there used to be a more accurate ELISA test, but the CDC, apparently the vaccines have some of these bacteria, these Lyme disease bacteria in the vaccines. So they have removed some of the indicators of Lyme from the Lyme test, because now that various people are injected with the vaccines, which harbor the Lyme bacteria, certain Lyme bacteria, we've lost a few of these markers that indicate Lyme. I don't know why they put various bacteria in the vaccines, but it just made things a little bit more complicated. So we have an incomplete um, indicator here. But anyways, this is when people get an ELISA test. Uh, this is the Western blot. Sorry. So the Western blot has Europe has a different determination of what a positive Lyme test is. So there's IgM and IgG, and I believe IgG is, I'm not sure if this is completely accurate, but one of the levels is for acute recent infection, and then the other is for antibodies, like long-standing, uh, and actually it's described here. No, it's not. So, okay, IgM and IgG. So IgM are made sooner, and then IgG are the antibodies. So if you have one IgM and 3 IgG, you're in Europe. Wait, in Europe, if you have one IgM and 2 IgG, I believe you're positive. And then in the U.S., you have to have 2 IgM and 3 IgG in order to be positive. So that's what the bands look like um, for that Western blot test. And so further symptoms, there's a doctor in New York State, upstate New York, where a lot of people do get stung by Lyme ticks. So again, Lyme is a clinical diagnosis, and Dr. Horowitz has had a lot of success with his fairly conventional protocol, and he takes into when in his diagnosis, and when I tried finding a differential diagnosis, I tried to find like an official diagnosis. What does the CDC say at length than what I just read to you? And there wasn't much. So what Dr. Horowitz elaborates on is he says it's important to take into consideration the appearance, cognition, the speech, but people may not be able to finish the sentence. They have rashes, maybe some discrepancy of body temperature, and one of the things about body temperature is orthostatic hypotension, which he is described here. And so there's so temperature changes, and he talks about gag reflexes, they're absent, and stiff neck, and Lyme shrug. So so if the person is just shrugging consistently as one, you're sitting there talking with them, he recommends taking a look at the liver and spleen to see, palpate to see if they're enlarged. Check the thyroid, if there's heart murmurs, and there's a cardiac domino effect if Lyme is left untreated. So here is, I'm just going to go more about Lyme testing. So these are more of the things that are being tested. So there's what's called a tick-borne relapsing fever, then there's syphilis, anaplasmosis, leptospirosis. So these are other things that are tested along with Lyme. And so we talked about the bands, and the thing about these tests with the Western blot is that they don't help people, a majority of the patients, 50 to 70%, remain undiagnosed or misdiagnosed due to the inadequacy of the testing. And this is the Journal of Infectious Diseases in 99 and 203, and that's, so they're talking about the early Lyme disease, acute, so the initial exposure, it gets, it records it up to 38% of the time. And then what's called persistent Lyme, or what they're describing here as late Lyme, it's like the two-tier testing can go at 44 or 57%. And some people might be like, oh, 57%, but I do not agree. So we looked at those tests. Now, what's popular are measuring cytokines, which are inflammatory markers. And there's the eye spot, which is a popular test, and there's also, so the eye spot is a Borrelia test, but these cytokine tests are actually just inflammatory markers. So it's not actually going to show you exactly what bug. It's just going to be able to tell you progress that you're making on your treatment. And let's take a look at microbes. So there's a lot of creatures out in the world, and the ones that seem to the ones that really this isn't even, I mean, this is clearly not them all, but so a spirochete. So Borrelia, the Lyme is what's called a spirochete, so it's kind of a spiral. And then there's protozoa, which there's one of which is called Babesia, which likes to get into the red blood cells, and the Babesia is what I understand to cause air hunger and affect our iron levels. Then for some reason, and unfortunately, those of us who have Lyme, it seems like our sinuses can get colonized by mold, what's called aspergillus, but there may be other species. So, and many of us have already heard of candida. So there can be, there's often a candida overgrowth. And another name I hear a lot is toxoplasmosis. So that might be another one to keep in mind. And then, unfortunately, in terms of these microbes, there are various worms, tapeworms and roundworms and flukes that can exacerbate infections. And so we have this panel here is various viruses. So we've heard of Epstein-Barr and herpes, and hepatitis. So those are pretty common. Then there's staph, and that's another one that can become persistent in sinuses. For some reason, people with Lyme disease often have chronic staph in their sinuses. And streptococcus, so strep is a pretty frequent issue for folks. And then there's mycoplasma. And then there's gram-negative bacteria and bacteroides, which is anaerobic. I've heard about that one. And so then there's okay, so zoonotic, I'm not sure I'm saying that right, but Brucella is one of the co-infections that is really makes people grumpy, rageaholic. Bartonella is another one that's uh, very troublesome. Coxiella as well. And then there's this chlamydia, no, not that one. Um, Rickettsia, Ehrlichia, Anaplasma, and Borrelia is familiar by now. Leptospira, I believe that's one that I hear about a lot. So this is just a snapshot of what our autoimmune system might be continuing with. So, um, so cytokine testing is helpful um, to just track success with protocols, and there are protocols out there, there are solutions out there, and some people might be like, well, why not just bomb all the bugs? Unfortunately, so they're calling persistent Lyme or late stage Lyme, they're calling this post treatment Lyme. So there are people who, when they got the Lyme lesion, they took their antibiotics and the Lyme did not get eradicated. And so then they took more antibiotics. And so some people took IVs, and there was tests with placebo, and generally there was not significant improvement in some of the studies. Like this 2001 study with IV, I don't know what, Ceftra 4 um, and doxycycline versus a placebo. So there's no improvement in fatigue or quality of life for that study. In the next study, there was improvement in fatigue, but not cognition. The next study, improvement in cognition in 12 weeks, but not 24 weeks. And then the next study in 2016, no improvement in fatigue or quality of life. So even though we like the idea of just taking a pill, bombing everything out, it really is hard on your digestive system to um, just bomb all of your bacteria, um, because it can take a lot of time to rebuild your gut flora if you even are able to do so. And we have now learned just recently that our brain has a biome, so our brain has a gut bacteria. Our eyeball has a gut bacteria, or has a bacteria, sorry. Our brain has its own brain bacteria. Our eye has its own eye bacteria. So you can just imagine that maybe your liver has a bacteria. Our skin, we know our skin has its own flora. So when we are taking an antibiotic, anti means against or replacing, I guess, and then biotic is life. So the antibiotic, um, and also it like it's not as effective. It doesn't even get to the some of the Lyme um, bacteria or viruses because they are out of the bloodstream. So Um, so sometimes you're just damaging your own biology, and we have learned, and the numbers keep on changing. But I've heard like 1 out of 10 of our cells, like, um, is only human. So like nine tenths of us is our bacteria and funguses and viruses and whatever else, and then 1/10 is a human cell. So when we're using antibiotics, we're killing off 9/10 of our life, and so just the more one considers these new facts, it's all the more reason to use discretion with such potent medications. So I just hope that I've made a case that there could be at least people in Montana who may have Lyme and co-infections, and that um, it's I mean, and understandably, it's a complex situation, and it seems to make sense to take symptoms into account along with testing. And being that our testing is quite a bit behind the times, using other um, guidelines of like looking at cytokines or white blood cell behavior, um, like natural killer cells. That's another test that's popular. So definitely, if you'd like to learn more, I can share more, maybe if you want to take a gander at these slides, or if you have some quick questions, I might be able to do another webinar where I answer your questions on um, either a webinar or this show. So find me on Facebook at Post-Traumatic Growth or My Post-Traumatic Growth, or Supernatural Boundaries. And you can also just contact me at 503-974-4848. And I will be having a networking event, a wellness networking event. It's called the Functional Forum at this time. And I have that once a month at the library in the boardroom. So if you ask the reference desk or even the circulation desk, they can tell you what day of that month. So it's pretty much every month. And keep an eye out for my next show on INCAT, which is every third Wednesday of the month. Thank you so much for watching. Thank you for your time and attention. And definitely be safe out there. Check for ticks. Um, take care of your immunity. Make sure you rest well. And see you next time. God bless.